Pharmacist shortage threatens medicine access in Nagaland. ANPA raises alarm. Kohima, June 20, 2025. The All Nagaland Pharmacy Association, ANPA, has raised serious concerns over the Department of Health and Family Welfare's (HNFW) move to strictly implement the policy mandating every pharmacy to appoint a qualified pharmacist. Speaking at a press conference held at Crescent International Hotel, Kohima, ANPA officials warned that such enforcement could cripple access to essential medicines across the state, especially in rural and remote areas. Addressing the media, ANPA President Zhapuvilie Yhashü and General Secretary Lima outlined the association's grievances and appealed for practical policy implementation in light of Nagaland's current healthcare limitations. "We are not against the law, but the state lacks the infrastructure to support this policy," said Yhashü. Nagaland doesn't have a single pharmacy institute, and the number of qualified pharmacists is grossly inadequate.
According to data cited by ANPA, there are 1,157 pharmacies in Nagaland, but only 278 registered pharmacists, a disparity that has become the core challenge in meeting the legal requirement. The association argued that strict enforcement would result in the closure of hundreds of pharmacies, severely affecting medicine availability even in urban areas like Kohima. Localities such as AG Colony, Merhulietsa, and Leri could potentially be left without a single operational pharmacy.
The crisis is expected to be more acute in districts such as Meluri, 6 pharmacies, no pharmacist; Shamator, 4 pharmacies, no pharmacist; and Phek, 34 pharmacies, only 2 pharmacists.
Since its formation on March 13, 2025, ANPA has submitted multiple representations to the Principal Director of Health, the Commissioner and Secretary of HNFW, and even to the Chief Minister, requesting a reasonable extension of time and suggesting interim solutions. However, the association claims all responses have been either negative or pending.
Attempts to meet the Minister of Health and Family Welfare were also unsuccessful, forcing the association to send their representation through a staff stenographer. During the press meet, ANPA leaders reminded the public and authorities of the critical role played by pharmacies during the COVID-19 pandemic, when the state struggled to supply basic medicines. There's no record of any life lost in Nagaland due to wrong medication by pharmacies. On the contrary, we were the first line of support for the public during the crisis, said Yanger. The association also raised questions about inconsistencies in policy implementation, highlighting that nurses in government health centers dispense medicines after a brief 3-month training. They suggested that similar practical arrangements could be extended to pharmacies until long-term solutions are in place. While reiterating their willingness to comply with legal standards,
here is like we have got something to tell to this, even to the government and even to the public, for what is happening here. The issues as they reach us, they have given the show cause notice in the year of 2021. So from 21 onwards, we are getting with this issue still today. We would like to make it very clear to the people of Nagaland that these issues is not only 5 years, 10 years. These issues has started from the time of since the existence of the Nagaland states. So it has gone, these are 40, 50 years issues is there. Now with this, the 40, 50 years of the issues that we have today, now these are the states is the shortage, the states is facing of this one, and where we have this from all over the 14 districts, which is affiliated to our association.
The issue of closure of pharmacies without pharmacists came to the fore and caught widespread media coverage and scrutiny. There were many instances where the pharmacy community was demonized. We were even portrayed as running our pharmacies illegally, which is not factual. In fact, we are also a victim of the corrupt system. The general public as well as our media was made to consume only one side of the story. ANPA could have, but chose not to react at that point of time. That is during February, March. Instead, we decided to have an in-depth study of the ground reality as well as the implications of the department's action on the overall health sector of our state. Now, I want to stress on this because in the tussle between the department and the pharmacy community, it will be the general public that will suffer. That is the point I want to stress. Now, at the present point of time, ANPA has done our bit. We have called this press conference so as to provide facts and figures and our side of the story for public consumption and cognizance by the Department of Health and Family Welfare as well as the Government of India. Now, I've said that we are also a victim of the corrupt system. Now, why I'm saying this is that is in the system. The system that is being followed by the department is our pharmacy licenses are issued by the Health and Family Welfare Department, wherein they provided the name of the registered pharmacist and their registration number. We were asked to pay a certain amount for the license which each licensee has paid. Then the licenses were renewed after every 5 years. Renewal fees are charged from each licensee. This process has continued till the early part of 2024. Now, we are kiba ita bole munase. We are the license ita thikai dibo. Itu license te apni video par cover koro mun chale dibi. That will be very good. Yate department ba dia dole S.R. Chaudhary is a pharmacist, person qualified in charge to look after this pharmacy. His registration number is 334. Now, system do kina thaki si bole do we are laymen. One layman ase. Aru when ba jania takto ile Department of Health and Family Welfare ba moenge edo pharmacy license to di when one jani luisi. So what we did is when application likhina jana department ge we asked for a license, a pharmacy license. When jana edo dise department ba ki korise time ba edo ready kori dise aru after a few days all of team bichide amni la license to ready hoisile logule ina hoise acha wana moen jaise jaina moen license uthale license la fee do iman hobo de ina hoise moen edo di dise. Now department bra moen ide jani ase de moen ide jani ase. The actual system is when applied rather than when asol doile when pharmacist la certificate luena jabo lage. Department never asked us for a certificate. Only then nami likhina disi to moen to bhabise maybe the department assigns someone to look after our pharmacies. To moen itu ba follow guse. Ina ona moen pharmacy to run great warna ise. That is the reason why I'm saying that our business is not illegal. We have been running our pharmacies legally run Guyazimuan. The other point I want to stress is, Onion Media and general public department is claiming that since 2020 by itula notice to tia suru hoisi. When pharmacy community land knowledge the first notification we got was in September of 2021. Yet I want everyone to think about this. I have a retention certificate in my hand. This is the retention certificate of a certain pharmacy that is provided by the department. Now, itula retention certificate it was given in 2023, and this license is valid till December of 2028. So department 2021, 2020 ba itula pharmacy pon gole pharmacist to mandatory hobo when then janina asu do. Why did they issue it? It retention certificate as there. They issued new pharmacy licenses even in 2024. Now, how is the department functioning? It was a big question that that is the reason why we are saying we are a victim of the system. We are a victim of the system. Ito ita. The other point I want to stress is Department of Health and Family Welfare started issuing orders to the pharmacies to appoint a registered pharmacist in the later part of 2021. Pharmacists in Nagaland took cognizance of the order, and hence pharmacy union was formed in each district, and efforts were made to appoint registered pharmacists, and at the same time representations were submitted to the department citing the difficulties faced by the pharmacists due to the shortage of qualified pharmacists and appealing for extension of time. No differences with NMDA. Our goal is the same, so that is the reason why we appeal to NMDA that it will be much better for all the pharmacy community if we can work together. When itu dalam SSP portray guru mana. Now NMDA form gura bichide, when NMDA ber kam gura pun wa ina ase. NMDA as a first step approached the department and submitted a representation to the principal director and the controlling and licensing authority, praying for a reasonable extension of time, but the answer we got was negative. Therefore, we decided to approach both the department as well as the government. We therefore submitted another representation to the Commissioner and Secretary, Health and Family Welfare, but again, the response was negative. Then, we have submitted a representation to our Honorable Chief Minister of Nagaland, and the response is still awaited. We have also approached our Honorable Minister, Health and Family Welfare, but we were denied appointment. We therefore send a representation to the stenographer to our Honorable Minister. When published Health and Family Welfare Minister do since he represents the whole Nagaland, we thought that he will be the right person to approach. One approach to try he is reluctant to give us appointment. Even his senior BS is reluctant to meet us. Maybe they are too occupied with some other works. We do not know. But I think we expect our concerned minister to at least meet us and hear our grievances, whatever be the outcome. We have also been trying to meet our Chief Secretary, but is yet to get an appointment. Chief Secretary, maybe when she was to try to appointment. Now, at the same time, when it took individual capacity as well as organizational capacity, when pharmacists to appoint globally try to when actually motor create appoint globally try to but the fact is Nagaland does not have pharmacists. Nagaland does not have pharmacists. I will come to that point later on in more detail. But even when when successfully employed we are putting in our efforts. Now the department at some point of time has claimed that we never took cognizance of their notice. No, we have taken it very seriously. That is the reason why organizations were formed, and we are putting in efforts. Polibi subji na thaya na mansu na pakai na mansu lode bag khabi bole do itu to bishi problem dangor one is na which is one problem do. We don't have qualified pharmacists in our state. Enough in Ogo. We don't have qualified pharmacists in our state. So itulah situation when they are forcing us to employ a registered pharmacist at any cost. Now, how do we go about? Are we ready one point stress problem? If the department can, think about the matter seriously, and since we are also stakeholders, if they can invite us, maybe together we can come up with a workable solution. That is also an appeal to the Department of Health and Family Welfare. Now, the other point I want to stress upon is ANPA fully understands the requirements mandated by law, and we are willing to abide by it. One pharmacist now only we are coming to know that mandatory as a pharmacist to rakibo again. Well, we want to employ the pharmacist, but give us some solutions. That is what we are asking. That is what we are asking the department. Now, this is also very important. See, Nagaland being the only state in India without a pharmacy institute is faced with acute shortage of qualified pharmacists. India being a developed country with inadequate manpower to mitigate the shortfall of qualified pharmacists has even introduced diploma and pharmacy courses but still cannot produce enough pharmacists. Moreover, no state in India has thus far successfully implemented this policy. In fact, according to our controlling and licensing authority, Nagaland is the first state trying to implement this policy. Now, yadi ekta kota ase. Nagaland even union territories TV soap the pharmacy institute ase. Nagaland is the only state in India which doesn't have even a single pharmacy institute. And even the Nagaland government is unable to send adequate number of students to study pharmacy courses on government quota. Now, what is their plan of action? How do they mitigate the problem? Because they know very well that there's a problem. But we don't see any efforts on the part of the department as well as the government of Nagaland to mitigate this problem. Sabi, advanced countries can, European countries can do diploma in pharmacy no loide. Time minimum qualification to bachelor's in pharmacy. Only India to manpower neither. India is still a developing country. We don't have enough manpower. It was then pharmacy diploma in pharmacy course be introduced for this. But still shortfall to be other states, actually to Google Grocery so pachanilo. Other states can decide Andhra Pradesh, Maharashtra, and 50, 60 institutes. There are 50, 60 institutes in those states. How many pharmacies are they producing each year? Nagaland is the only state without a pharmacy institute. The government plan of action to be years here. Our still other states can one pharmacy institute that it to policy to implement no state has successfully implemented this policy. In fact, in some states the matter has been litigated. It is under litigation. So, Nagaland itu condition our controlling and licensing authority has proudly told us that Nagaland is the first state to try to implement this policy. Are we in a position to implement this policy? I think it's a big question that the public deserves an answer. Public deserves an answer to this. Now, if you look at the ground reality based on various data, the ratio of pharmacists in Nagaland to the number of pharmacies in Nagaland to the number of registered pharmacies is quite disproportionate. As per the data provided by the department and published by the Nagaland Post on the 14th of February 2025, there are 1,157 pharmacies in Nagaland. Ito pharmacy khuli na thane aside. License lui na pharmacy no khulian no kiman 1,000 ho ito do when kuwana parbo. Ito do data kali possible. I don't think it will be a small number. Whereas there are only 278 registered pharmacies according to the Department of Health and Family Welfare. Now, let's work it out. Time ra Nagaland Post ko isap dito, aro Nagaland Post publish ko isap dito, 1,157 operational pharmacies in Nagaland. Whereas time ra data provide ko rato 278 registered pharmacies in Nagaland. Out of 278, 252 the government employees are there. So government employees cannot run a pharmacy. So let's put them out of the picture. Now how much are we left? We have 26 pharmacies left in Nagaland to look after 1,157 pharmacies. Ito ay kasi. When grievances fee, ito ay. The other point, I think this is very important. Impact of the policy on the public health sector. ANPA, after thorough analysis of the ground realities of the view that if the government is to implement this policy in its entirety, will put the public health sector in complete disarray. Here are some data in support of our views and for the consumption of both the general public as well as the department. Even in Kohima, the state capital, some colonies like AG, Meluri, etc. will be left without a single pharmacy. How is the one Kohima la where is there? Our AG colony is the largest colony in Kohima. Government pharmacy sub to shut down for this little. Leri dilo ekta pharmacy na bachibo, Meluri chadi ekta pharmacy na bachibo, AG colony dibi ekta pharmacy na bachibo. So itya stop 18 rupees per kinule colonial pharmacy di kini thalo. The nearest place they can go is PR Hill. Just think of the inconveniences caused to the public. Our rati bimar ekta hosi kiba ekta hosi, even basic medicines we dibo na parule. Even a simple headache, probably manu muri jere. Holy suddenly rati di bimar hosi goli to put per lobo. Morning no hada disorder morning that morai divide we na ukhawo na ye. Ito last situation itali ase. That is about Kohima. Let's look at the data of some districts. Meluri, Shamator, Phek. Meluri presently 6 pharmacies ase. Pharmacy choita ase. Tate ekta bhi registered pharmacist nai. Shamator de 4ta pharmacy ase. Ekta bhi registered pharmacist nai. Phek district de 34 pharmacies ase. Tate 2ta in-service pharmacies ase. So in-service pharmacies can do license to cancel go lage. So just think about this. Meluri, Shamator, Phek can do whole district without a single pharmacy run rule. Public law health to kila position ekta de rakhi dibo. So it district headquarters na ase. Now think about the subdivisions and rural areas. There will be complete chaos. There will be complete chaos. Now we want to ask the department, the wider question is the department in a position to fill the vacuum? Time pharmacy so bon go. So time la policy to kiya ase. We are going to close down all the pharmacies, and in the meantime we are going to do this so that the public doesn't suffer. Time ito la point of action. Ektabi asina ne. Time la concrete policy ektabi asina ne. I don't think so. Now another point we wish to stress upon is that there is no case in Nagaland where a patient's life was either lost or put in jeopardy because of wrong medications administered by any pharmacy. In fact, everyone must refresh our memory and think of the services provided by the pharmacists during the recent pandemic, that is COVID-19 pandemic, when the department or the government was in no position to even provide basic medicines to the general public. Now, at that point of time, the burden and responsibility was borne by the same pharmacies that the government and the department is trying to shut down. It is the one so public, general public view, we couldn't probably know it COVID-19 to kill a situation like this. Pharmacy and was the government even in a position to provide even basic medicines? No. What if another pandemic comes? Transition to smooth wall like it. Transition has to be smooth. There must be a solution. There must be a solution. Of course, we are not saying that the policy is bad. Nagaland has to move forward. Nagaland has to move forward. So, of course, changes has to be brought about. But these kind of drastic decisions will put a huge vacuum in the public health sector. That is what we are observing. Now, the other point is, health is a state subject as per the constitutional provisions. meaning any state can frame health policies that is relevant and applicable to their state. Then the question is the government of Nagaland and the Department of Health and Family Welfare Department equipped adequately to step in and fill the void? Now I want to ask the department, do we even have a Nagaland specific health policy? If there is, make it known to the public. But I think the answer is a big no. Our government is unable even to appoint qualified pharmacists in all the government-run health units. Now I want to provide some data here. Public health units. Government-run public health units, TV department pharmacists, sufficient pharmacists appoint government partners there. Mon district एक बार सावो, सब district ना सावो ले मुई कोनो district ला data दिगो. Mon district ए शंगियो, ओटिंग, वांचिंग, अंगबाम, मोकोम, योंगथो, TDC mon. Itu kan the government registered pharmacists appoint government partners there. Phek district ए वो, CMO Phek, Chief Medical Officer Phek, TBA. Only 2 pharmacies are there, whereas the sanctioned post is 3. Tadi bisa contoh, Tetsome, Kuzame, pharmacist na. Public health units to Kulise Olive, pharmacist appoint government. Meluri di Parsawa, 4, Lepore, Baziho, Akiko, Sitze, Hutze, pharmacist na. So if the government, even the government is unable to appoint adequate number of registered pharmacists, timely solution to key diase. So in the meantime, what the government is doing is to solve the problem. What the department does is to impart a 3 months training to the nurses, and now the nurses are dispensing medicines to the patients. Should the same yardstick not be applied to both the pharmacies as well as the government-run public health units? So dahil na public health units, the pharmacists appoint government na para 3 months training course di na nurses kan medicine di wali dia si do. They are not registered pharmacists. Should the same yardstick not be followed to both the pharmacies as well as to the public health units? Time the pharmacists na thagya ba appoint government na pare na sinagi. To tarbo appoint government na pare, ang mga ito job for just appoint no could probably appoint government lagi. Ito ikas din. Now, ANPA is of the opinion that the department can come up with such programs if they have the will and are concerned about the public health.